Dr. Emily Splichal, so good to have you on the show. Welcome.
Thank you so much. It's a pleasure.
Well, to kick this off, let's draw the audience in. Tell us about dropping out of undergrad and quitting your medical residency.
Yeah, it makes me sound like I'm a quitter. Those were two pivotal shifts in my journey, I guess, to finding who I was, my purpose, really what defines me. Where when I dropped out of undergrad, it was actually because my parents had divorced. So I was so like the rug was pulled out from under me that I just was like, the only place that is resonating and speaking to me at that moment was New York City, and my undergrad was in Minnesota. Cold. Don't understand why I would want to be there anyway. So I was like, I'm going to New York, and just kind of New York shaped my life. It just defined who I am, and that anonymity, and it'll like eat you up and spit you out and just build character. And I feel like I needed that after that. My sister lived there, so I actually had a little bit of kind of stability that I could anchor onto when I was there. But it was me moving to New York that fed a part of my soul. I was then doing a internship that I also left. It was a forensic internship that I left. So I quit that also and got into fitness. And me walking into a gym and saying, I want to be a personal trainer. I didn't know what a personal trainer was, but I love movement. That was the second thing in my life that fed my soul. And I felt like I was home. So, New York City, I felt home. Being in the gym and doing fitness was the second time in my life that I just felt full in my soul. Long story short, I started getting injured. So I was like, okay, I can't do fitness for a career. So I need to find a graduate profession. That's how I got into medical school because I wanted to be able to still do movement. So I went to podiatry school because there was a podiatry school in Harlem, which means I could stay in New York and I could still train in the gym. So the two things that were required for my soul at that time is why I chose podiatry. Of course, when I got deep into podiatry, I was like, what am I doing? Like, feet are disgusting. Like, why am I here? But then I started to say, okay, I could use this and apply this in a way that I want to. I love movement. How do I use this podiatry degree to then apply to movement? What I didn't realize is that podiatry school is very segregated and it's not looking at the body from an integrated perspective. So I was going through school fighting the reason why I signed up in the first place, which is where the next quitting experience is. I graduate podiatry school. I'm starting my residency. Residency is all in feet, isolated surgery. I was miserable. I was like, this is not why I went to podiatry school. So I quit residency and then I went back to school and I got my master's in human movement, which was the pivotal piece that connected my passion for movement and fitness with my medical degree. The glue is, or the bridge was my master's in human movement. I did go back, for all the listeners, back to residency so that I could finish the requirements so I could get licensed. And now I'm a licensed podiatrist, but I take a very unique perspective and I had to find that bridge, that connection between fitness, movement, that passion with my medical degree. And I don't think that I would have found that if I didn't leave residency and then get my master's. And then the last really important piece is that as I was getting my master's, the Born to Run, Barefoot running boom was happening. So this was 2008, 2009, like around those. And I focused my master's degree on footwear science, barefoot science, surface science, anything that was interacting with the foot ground relationship. That's what I focused my master's on, and all of the research reviews that I was doing, which then shaped how I look at patients now. So this barefoot science perspective, integrated foot connected to the rest of the body. It's really movement specialist. All of that was necessary. And that was partly based on me quitting certain things and pivoting to find these different aspects of my deeper purpose.
That's an awesome story. I'm curious, what gave you the courage, or how did you make those decisions to really go against the grain and, first drop out of undergrad to go be in the environment that you wanted to be in, and then have the courage to, quit residency, which, you've invested all this time and all this money to get through all this schooling. Like, how did you make those decisions, and where did kind of the courage or the inspiration for that come from?
I definitely think that it was intuition and listening to my gut, which we all have that. And there's points in our life and pivotal moments that we either choose to listen to it or not. And I feel that, I don't know, like your intuition knows. And if you look at like deeper research on like the gut biome and like there is something to intuition and the intelligence of the gut and gut feeling. And then it was just having faith. I don't know if that's just something that I was born with. I was born in a town of 300 people in the middle of nowhere in North Dakota. And I knew as I was growing up that I was like, there's something bigger to purpose and life, and I will not be confined to the borders of this state. And there is so much more of why I was put on this planet. I think that combined with me listening to the intuition, and then maybe New York being the perfect breeding ground for that opportunity to just be like, go get it, like grab life by the balls and, kind of go.
Yeah.
I just think that all of that together is what gave me that courage. And it's very, oh my God, it's so scary to do that, to go into the unknown and to like step off of the edge in a sense. There's a saying in um, parkour, which I'm sure you're familiar with parkour, and it's called breaking the jump. And breaking the jump is when you are essentially jumping from, let's say, one building to another. So it's a obstacle or something that is very scary. It's intimidating, but in the theory of parkour, breaking the jump means that you could actually achieve it. So breaking the jump means just going for it. You can't hesitate at the edge of the jump. You just have to go. And your ability to just go is partly based on the knowing inside yourself that you'll be able to make it. And I so that saying really resonates with me.
Yeah, I love that. One of the things I believe in is that fear is the way shower. Like, when you're scared to do something, but you really want to do it, like secretly, maybe you even haven't publicly admitted it, like that's where you need to go. But it does take a lot of courage. And I really also love how you followed your interests until those interests either were already a passion, like you're passionate for New York, and then you followed your interests in, these other areas that then turned into full-blown passion because you developed a certain level of skill and strength, and then people wanted to pay you for it, and you were able to, really like, uh and cobble is the wrong word, but like cobble together your life purpose in a way where your work was deeply meaningful to you. So,
100%. And I get asked that a lot, that they're like, how did you know or understand the process to bring your passions together and use medicine in a very unique way? Like young students will say this to me. And I almost feel like saying like like almost don't follow my path because it was so irregular, and you can't just, graduate, let's say medical school or chiropractic school without the prior past that I was building. So I was also building my brand and my specialty 10 years before it came into fruition. It's kind
mm,
of like the world knew that, like, if you're, I don't know if you're spiritual, but if there's kind of the spiritual thing that they're like, okay, I'm starting to shape this 10 years before you will even understand what this is going to eventually look like. And it's hard to describe that to someone younger who hasn't started some of that process, in a sense. And that's another characteristic of this, that I feel like, to have the ability to think in the future and make decisions now, knowing that it will be there in 10 years. You always have to be focused on the big picture. You can't be too in the now. It's good to be in the now for like a happiness and a joy, but you also have to think of every decision I make today ultimately is going to have an impact and show face in the future. Don't know when, but somehow in the future.
Yeah. I can definitely relate to that because, I just turned 41 and I feel like I'm really like I've slowly like everything's finally culminating into kind of like my true calling, but every
Yep.
little thing I did along the way has played a part in it. And so it was, similar to you, like I dropped out of Stanford University and then I ended up working in Hollywood nightclubs for 8 years. And then literally left that career, went back to Stanford and with no plan, and somehow became a part of a Stanford startup. And then that Stanford startup led me down some more paths, which has led me to both this podcast and my fitness and money coaching program. None of this I could have ever predicted, but I kept
Mhm.
like listening to that, that voice in me that was, or that pull in me that was just telling me, okay, you've done your time here. Like, even though this is non-standard to like stop out of school and then not go back, and then it's time to go back and finish school, even though you're making a lot of money and super successful, but unhappy. And it's just following that, like that. And I'm definitely spiritual, but it's like following that spiritual pull or that calling that is like,
Mhm.
okay, I'm on the right path, but I'm not where I'm meant to go yet. So I got to keep
Mhm.
going.
Mhm. Patience in the process is part of it as well.
100%. So, okay, how did you transition from basically, and just to give the audience a little bit of your background. So you're a podiatrist, you're a human movement specialist, a global leader in barefoot science and rehabilitation. You've developed a keen eye for movement dysfunction, which we're going to talk about because I think I have some, and neuromuscular control during gait. So, originally trained as a surgeon through Ben Israel Medical Center in New York City and Mount Vernon Hospital in Mount Vernon, New York. In 2017, you put down the scalpel and shifted your practice to one that is built around functional and regenerative medicine. And I would say even maybe even more fascinating is the fact that you then have recently in the last few years gone on to start and co-found Naboso, which is a sensory technology company, and you're also the CEO of that. So the next kind of transitional story I want you to share with me and the audience is how did you like put down the scalpel, move into functional and regenerative medicine, and then go on to co-found and become a CEO of a company?
Yeah, how long do we have? No, I'm just kidding. So I think that that connection of me going back to school to get my master's in human movement, so that was this glue or this bridge. So it was a lens or a perspective of how I look at my patients. And I started that on day one after I graduated residency. Now, having said that, a big part of podiatry and podiatric residency is to do surgery. So I was trained as a surgeon. They try to push podiatrists to be surgeons. That's how you make your money in podiatry, is by doing surgery. So there is this tendency towards wanting to do that or needing to do that. So I did it for 5 years. I did very traditional podiatry under insurance in a large practice in the middle of Manhattan, seeing, the uh, kind of revolving patient who's coming in, where I see 15, 20 patients a day coming in. Now, what I would try to sprinkle throughout that is my integrated philosophy of barefoot science, foot to core, pelvic floor, how are you breathing? What are your stress levels? So it's this whole other side that I had and have a passion in, that I was trying to weave it in just to see how patients would respond to it. Then I started getting patients coming in to see me specifically because they started to find out that that's how I treated patients. So I started moving a little bit away from the traditional way of patient care of what I learned in my training. Now, at the same time as this, I had started my education company, which is an education company for professionals. It's called EBFA Global. And I would travel the world at 3 to 4 weeks at a time, educating podiatrists, chiropractors, massage, yoga, every allied health specialty around the world. So I've been to 35 countries teaching. And then I would come back to my practice, and it would be very hard for me to do surgery and then leave the country for a month. And then who's going to take care of the patient post-op? So I started finding, okay, out of respect for the patient, plus it's not my passion to use the scalpel, I'd rather use this integrated approach to start to pull away from surgery and really push the specialty of functional regenerative podiatry. So I started to kind of tease it to see how people were responding to it. And then in 2017, it was another point of this breaking the jump, something very scary. I had one foot in traditional podiatry under insurance with my practice, and then the other foot, pun totally intended on this, in what's called direct care, which means I'm dropping all insurance. So once you drop out of insurance, it is very hard to get back into these insurance companies. So I'm doing that. I'm not doing surgery anymore, which means all of that training, I'm going to lose that skill. I can't, my hands aren't wet anymore. I can't do surgery once I leave surgery. So it was very scary. And I was like, can I do this? Can I go and say, I don't take insurance. You have to pay cash to see me. But eventually, intuitively, I knew that I had to do it. It's my passion. So then I left in 2017. And I was supplementing that through my education company, traveling and teaching about integrated foot and functional podiatry. So I was kind of doing that as I stepped away. Now, at the same time as this, through the education company, I started getting awareness through different brands. So I started doing consulting for Nike, for Vibram, for Vivo Barefoot. So all these shoe companies that were saying, oh, wait, let me just sit down and listen to what this podiatrist is saying about foot health in a completely different way that is challenging cushion, structured shoes, orthotics, arch support, all of that, just for their innovation kitchen, like the Nike Innovation Kitchen. It's who I did a consulting gig with for several years. And they would just come to my office, put a recorder in front of me, and just say, talk. And I would just talk about things. They would show me shoes and I would just tell them things. They would show me ads and I would say, this is what I'm thinking when I see that ad. And it would just kind of shape them and some of that thought process. So that's kind of happening, right? And then finally, I'm getting to the Naboso part. As all of this is happening and me doing consulting for many different brands, there's a fitness brand that I'm doing consulting for, and their COO happens to be an engineer as well. And he leaves the company and contacts me, and he's like, you've spoken a lot about wanting to innovate products. You have some product ideas. I'm no longer with this company. I'm an independent engineer. Let's work together and let's develop some of this product that you're thinking of. And then that's, long story short, what led to Naboso was me saying, I want a way, what's not in the space that I feel is needed is a way to further stimulate the feet once these people take their shoes off. So if an athlete is into barefoot movement, barefoot squats, because that's what was trending, right? What do they do then? What are they standing on? You can't just take your shoes off and think that whatever surface you're standing on is going to optimize the the stimulation and the strength of the feet. So we need something more. So I worked with him to look at surface science, and then I got into texture, and that's where I developed the first product for Naboso, which was a barefoot training mat, and that was in the beginning of 2017. And that's when I launched my first product. Fast forward that to where we are now. Naboso is a full product line. This year we're doing about 6 million in revenue. We're all over the world and have new products that are being developed.
That's an incredible story. So, one thing I always like to kind of pull apart is the timeline, because you've delivered the story in a very eloquent way, which seems like, she's like an overnight success. She's serial entrepreneur. She started this education company, and then she started Naboso, and it all just happened over kind of what period of time did that happen? I sort of got some of the dates, but I just want to kind of draw it out for the audience. Like, as you're going through this transition, kind of building up these other parts of your business and your thought leadership, like, what was the time period? How many years?
Yep. So that was about 5 years. So 2012 to 2017 was the height of that. And that parallels with me finishing residency in 2012. And
Hmm.
mind you, I took 2 years off to get my master's. So then I came back. So 2012, I graduated residency, got licensed, and then boarded a plane to go to Asia for 4 weeks and teach and start teaching. So right away from the get-go, my career was built around balancing private practice with this education company and trying to really push and pursue my unique perspective to the integrated foot function. And that journey took 5 years. And what I learned is that every time I would teach my certification, so I have a 2-day certification through EBFA Global called the Barefoot Training Specialist. And every time I would teach that in another country to another 40 people, I would learn things and I would say, okay, I actually want to word that different. Oh, let me connect this. What if I did this? Then someone would ask a question and I'd be like, brilliant idea to connect this. So it continuously evolved. And then I met other professionals, chiropractors, breast specialists, body workers, trauma specialists, somatic experiencing specialists. So I started to just evolve in those 5 years how I looked at feet fascially, sensorially. So it just became this 5 year journey for myself as well, traveling the world, treating patients. And then the innovation of Naboso was 2015. And it took 2 years to figure out the tooling process, the material, the specs, so everything so that it could deliver what I actually wanted it to deliver. So 2 years and probably $75,000 worth of tests, this first production run. So I learned a lot in those first 2 years through Naboso of
What
the innovation part. The company was even formed at that time.
was the 75,000 self-funded, or did you get outside funding?
That was my savings. So that's where also
So much
this
courage, Emily.
parallel. I know, but that's part of why leaving conventional private practice under insurance with this group that I was an associate at the group was while I was innovating the Naboso product and using my savings to try to innovate this product was happening as I was like, do I leave conventional medicine? Do I go into direct care? What if no one will pay me? Do I leave surgery? That happening at the same time as me trying to innovate a product is part of what compounded the hesitation, but then it was a necessary step or jump, if you want to continue with that, that I had to take to elevate me as a thought leader. And then ultimately, that's what led to Naboso being able to leverage me being a thought leader when I first launched the company or
Yeah.
the product. It was a product that launched it, not a company.
So the name of the company, was that why you're on one of your education company trips? how you came up with the name Naboso?
It was, yes. Naboso is a Czech word that means barefoot. And I was in Prague and I had hired a company in the US. I think I paid them $10,000 to try to come up with a name for this company, this products company. Um, and I was like, no, 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 doesn't, it had to speak to my soul. Like if it
Mm,
didn't give me goosebumps when I saw it, I couldn't go with it. And I also wanted a name to the company product because again, at that point, I didn't know what it was going to be, that wouldn't put a ceiling over it. So it had to have a meaning, but I can't be limited by something that that word was actually restricting.
yeah.
Um, and then I was in Prague. This person was taking my training and they had the word Naboso on their shirt. And I was just drawn to the word. And I was like, what does that word mean? And they said barefoot. And I was like, perfect. Totally, totally need that. And then one of my mentors and someone who really inspired my work years ago, starting in 2010 2012, was Dr. Yanda. And Dr. Vladimir Yanda was a Czech physiatrist. So I also really like that he was Czech. He was so influential on my work, and that this is a Czech word that means barefoot. So all of that together, I just felt like it was perfect to use that as my company name.
I love that. So much heart and meaning behind your work.
Yeah.
Question for you. Because I know a lot of people are thinking through this. Like you made this comment where you said, I spent 10 years like building my brand before I did all this stuff. So if you were to mentor or coach someone who's, 10 years before you in maybe a similar path but different, maybe they're interested in hands or like, necks or whatever it is, how would you encourage them to build their brand and their thought leadership like before they do the thing?
I,
Or how did you do it? Like you had your education company, but were you writing blog articles, creating YouTube videos? Like how were you building your thought leadership?
yeah, so what I was doing, there's another layer. I think there's so many layers, but there was another layer that a big part of what I do is I educate, but I speak on the conference circuit.
Mm,
And that is really important. And that part also speaks to my soul. That I remember when I went to my first fitness conference, this was probably 2007, 2008, something like that. And I was in the lecture and I'm looking at the person on the stage or in front of the room lecturing or speaking. And I was like, I want to do that. I don't know why. It's just something that I was like, I want to do that. I'm going to do that when I grow up, right? Like that person, that role. And I sought it out and I started just applying and oh my God, I was so bad when I started, so bad. People would just walk out of my lectures. But that was an important part of it. So then I started speaking on the conference circuit. 12 years ago, not good. Now I've been doing it for 12 years. So hopefully I'm better than I was. But that was important. So the barefoot
mm,
running boom, right? It's 2008, 2009. I have my podiatry degree. I'm speaking on the fitness circuit because I've been in fitness for 10 years at this point. So I'm speaking on the circuit. I can start to talk about feet because I'm theoretically a podiatrist. I wasn't licensed at that point. So I was like, okay, how do I start to bridge these from an education perspective? Now here's the barefoot running boom. I'm going back to school to get my master's. People in the fitness conference circuit are starting to talk about shoes and feet because it's what's trending, right? And I
mm.
was like, by golly, if anyone should be qualified to speak about feet and fitness, it should be the fucking podiatrist in the room, right? So I was like, I'm gonna own that. That is my niche that I am going to own, right? Because I've got the fitness. I've been in fitness for 22 years now, and then I have the degree. So I was like, that's what I'm gonna do. So I started to really shape and position myself as this combined fitness foot podiatry specialist on the circuit. and started to question things and look at trends of what were people wanting to learn at the conference. So that's part of it as well. And that thought leadership has now, 12 years later, if there's anyone who's going to speak about feet at a conference circuit, usually they will then invite me to speak because they're like, she's been doing this for 12 years. So perhaps that's some of it. What I saw was the sea of other presenters, look at myself, what defines me, how do I differentiate myself from all those other people, what is my niche, what is my little special sauce, and then really define yourself that way. So that would be some of the advice. And similarly with podiatry is there are thousands of podiatrists. Like, what is going to differentiate me from the guy down the block when we both treat feet? We're both DPMs. But it's like,
Yeah.
no, I take a very unique approach and I have to build awareness through Instagram, blogging, videos, YouTube, that people know that I'm not the same as the guy down the block. So they come to me. And that's what people also want to do.
I love that. Thank you for sharing that story. And I think for the audience, we all have these like interests that can turn into strengths, which turn into superpowers. And then when we like combine them together in a unique way, then we stand out and stand apart from everybody. That allows us to really step into thought leadership in a very specific way. And Emily has like done this like beautifully in her life, and now has a company behind her in addition to her practice. And I really appreciate you illustrating that, because I really believe everybody is unique and has unique strengths, or at least interests that can be developed into strengths, and then passions, and then like superpowers that allow them to really, you know, live a life that is full of heart and meaning, and where they're following their calling. So I appreciate you sharing that.
Yeah, absolutely. If I could just say on that real quick as well, is that if you are, so you're trying to exemplify someone, or you're so inspired by a person, a presenter, a CEO, something like that, maybe an influencer, and you're very inspired by them, you are trying to achieve what they're achieving. You can be inspired by them, but don't try to be them in a sense, because it's not going to be authentic. And what I found in my presenting style, because again, I was like, well, how am I going to present? Do I follow Steve Jobs, or what's my style? Right. Is until I just like let go and like was present and was truly authentically me when I present, it then like unleashed this different thing. And I know that like public speaking, or speaking in front of an audience is, a small piece, but it is such my purpose to public speak and to teach. And when I'm on the stage, I literally am fully 100% present in my purpose, that I don't care what I look like. I don't care. Like, I am so passionate about what I'm speaking. And it wasn't until I stopped trying to fully mimic other presenters that I looked up to, and I found who was me and what's my style, that it can be very genuine, then I was able to kind of reach this new level of presenting. And I think people then recognize that. So when I teach about any topic, people get very engaged because I'm so passionate, and I don't have any formal public speaking as far as how to inflect and engage and
Yep.
read people. I just think that those are my kind of intuitive skills, but I do it naturally by following the audience, and then we'll kind of pull back. I'll pause. I want to feel them kind of like this dance that they're doing. So I would encourage the listeners as well, is to just kind of also let go of trying to be too modeled after someone, and be you, find you.
Yeah. And I'll build on that. The only way to get confident at doing anything is to do it. And like you just were like, I want to be a conference speaker. So you started doing it. And you said yourself in the beginning, you were terrible. Right. But then like you put in your reps, and you got stronger and stronger and stronger as a speaker, to now where you're like a very dynamic speaker, both on, at conferences, on Instagram, on your YouTube videos, on podcasts. Like I listened to several podcasts in preparation for you, and it's like you're so engaging to listen to. And each one of those podcasts I listened to in preparation, you spoke on different areas within the kind of similar realms. But I was like, oh my God, I just learned a bunch of new stuff and saw it in a new angle. And she said it in a different way. And it really helped like fill out the pictures of this kind of, I don't know, science and philosophy of fitness through the feet that you have. And that's super awesome. So let's dive in to kind of your philosophy of building feet that are fit for life. Like, how do people start thinking about, they're wearing shoes and they always train in shoes and they want to start transitioning into more, barefoot training or walking or even running or other types of athletics? How should they start to think through that?
Yeah, absolutely. So the way that I like to explain feet is by first building this appreciation that your feet are not just mechanical structures. So traditional wellness and shoe companies and even podiatry look at the foot very biomechanically or mechanically, meaning like you have a high arch, you have a low arch, how much ankle dorsiflexion do you have? Like that's very mechanical, but there's this other aspect of the foot that is even more powerful, and that is the sensory side of the feet. So I just want the listeners to appreciate that we have this mechanical muscle joints, but we also have thousands of nerves in the feet and fascial lines that are deeply integrated into their function as well. Other aspect is both mechanically and sensory and fascially is that your feet are very interconnected with the rest of the body. And the part of the body that they really are connected to is going to be your hips and your pelvis, so your core, which is your center of mass or your center of gravity. So optimizing healthy feet, healthy movement, healthy foot strength means that your feet have to be connected to your core in a strength stabilization perspective. And that's a lot of what I'll teach other professionals to do. And then I teach my patients to optimize and unlock foot to core stability or foot to core strength. Okay. Now, having said all of that, there's three foundational components. And actually, I added a four. So now we have four components to fit feet for life or healthy feet. And that is going to be sensory stimulation, strength, so integrated strength, mobilization, and then balance. So the ability to stand on one leg. So these are just kind of components that I want people to incorporate every single day into their routine. Sensory stimulation could be standing on any of the Naboso products that have texture, using a vibration platform, being barefoot around your home. You have the neural balls, so standing on that and getting that textural stimulation. It is waking up the nerves in the bottom of the feet so you can, quote unquote, feel your feet. If you cannot feel your feet, how do you strengthen your feet? How do you balance? How do you move if you can't connect to your foundation? So that's very important. Second one is going to be the foot strength. This is strengthening the intrinsic, so the small muscles in the feet. These small muscles, you can think of them like your core, is that they are part of your stabilization mechanism. And their strength is directly correlated to pelvic floor and TVA strength. So when I teach foot exercises, I coordinate them with a core contraction. And because your core is connected to your diaphragm, technically I have to cue you to breathe a certain way when you engage your foot. So the easiest way to explain that would be toes go down. So when your toes go down, you technically are activating the intrinsics. As your toes go down, you would lift your pelvic floor and you would exhale at the same time. So I teach that stack or that strength activation technique to people. It's called short foot. So if you want to learn more about it, you can just search on YouTube short foot, and I have many videos on this. So that would be the strength. The third component would be the recovery. That's where the neural ball would come in. And I want people to do at least 5 minutes a day, ideally twice a day, but 5 minutes a day of releasing the feet. This is supporting circulation. This is stimulating nerves. This is giving a little bit of a massage and a reset to the muscles in the bottom of the feet. And I recommend doing that when you brush your teeth. So
Mm,
5 minutes, release your feet while brushing your teeth. You can make it part of a lifestyle and a habit. And then the fourth one that I just added on is going to be balance. So, an important part of optimal foot function is the ability to stand on one leg. Our ability to stand on one leg was and is necessary to being able to walk. So, the evolution of bipedalism was paralleled with changes in the feet and the pelvis that allow us to stand up and stand on one leg. So if you can stand on one leg, you're able to take long steps. And being able to
mm,
take long steps allows you to walk fast enough in a way to load your fascial lines, so the connective tissue lines in the body, which is very hydrating. It's very stimulating. It's also very efficient. It's how your body loads and unloads energy. Also, walking at a certain pace is necessary to get sufficient circulation through your system. Think of it kind of like a pump, to get the pump going so that you get enough blood to your brain to support the neocortex. So, just evolutionarily, you could see that there's parallels of, oh, I can stand on one leg, I can balance, I can take long steps, which means I can walk faster, which brings up more blood. And that was part of the parallel of the neocortex developing in the way that it is. So when I see a decline in foot awareness, integrated foot strength, foot recovery, and balance, that's where I start to see a decline in movement optimization and therefore longevity.
gotcha. Sorry, there's a slight delay. And so I'll have my post production team cut out the delay. So I'm just making sure that you finish before I ask the next question. It may
Mhm.
be slow bandwidth on my end. But I want to talk about the Naboso or the Nero ball for a quick second, just to kind of illuminate the listener as well as the viewer into what some of your technology, your sensory technology, actually looks like and feels like. So, would you kind of like how would you describe this thing? Because for years I used just like a squash ball, and then in December, January, I started using the Nero ball, and it's similar to a squash ball in that it's a ball, but it is radically different at the same time. So walk me through kind of the technology as well as the features of the Nero ball, and I'll kind of like demonstrate it, and we can kind of illuminate it for the audience verbally as well if they're listening.
Yeah. So imagine a ball. It's a little bit smaller than a lacrosse ball, and it has tiny little pyramids across the entire ball. This is very important. And that texture that you can see is, or if you can't see, is little tiny pyramids. That is actually, Naboso has the patent around that textural pattern for the purpose of stimulating the nerves in the bottom of the feet. So these little tiny pyramids are a very specific height, shape, and distance from the neighbor to stimulate a certain nerve in the bottom of the feet. That nerve is the same nerve you use when you read Braille. So it's
Mm,
stimulating 2-point discrimination. I just want the listeners to understand that. Now, the ball will actually split into two pieces. So now you have two domes. So you could stand on the two domes at the same time and do pinpoint pressure release. So we've actually found that you get a better release if you hold the pressure. We recommend 30 seconds per point. And then you go to position number 2. There's 5 points that we recommend in the bottom of the feet. That pinpoint is getting a compression. And then when you release, you're actually releasing compression on the soft tissue and the blood vessels, that you get a rush of blood to the area. The texture has also been shown to increase microcirculation. So it's a very circulation inducing, in addition to being like a massage. a lacrosse ball, a golf ball, those are all smooth. And most people will roll on them versus doing pinpoint pressure.
Mm,
So we want the pinpoint pressure. So both feet, 30 seconds. In addition to that, you get the texture, which is neurostimulating and microcirculation stimulating. And then within the ball, there's a little black ball. For the listeners that do not see it, it's about the size of a large marble. And it is a hard ball that is designed to be used similarly, not to roll on the feet, but to stand on and get an even deeper pinpoint pressure. So that combination makes it a 3-in-1 tool that we have seen very good results with, say, like plantar fasciitis and different conditions like that. It's also very ergonomic, where if you're thinking of like a lacrosse ball on one foot, it's very shifting to the pelvis, which if something is ergonomic and it feels uncomfortable to the body, compliancy is going to go down. It's very important to me that it is going to optimize people to want to do it easily. So the two dome design, not too high, helps your pelvis stay level while you're releasing your feet.
mm. Yeah, and just to let the audience know kind of how I use it usually. So I don't do it while I'm brushing my teeth, but that's actually genius because I do brush my teeth every morning. But after I brush my teeth and like make my morning like matcha, like I'll like stand in my creative studio and I'll like start rolling out my feet with the Nero ball. Then I'll split it in half and I'll just kind of go around on both feet. And then I actually take out the small ball and I do both kind of like standing pressure, but I also get a little like into the pain and like do a little rolling as well. It like it kind of hurts good, but I've also been doing a lot of barefoot training that I've trained up to over the last year. So I think I can handle more. Like if someone's just getting into barefoot training, stepping on this little ball and rolling around will probably cause you a lot of pain that won't be fun. But you can build up to it, and then I even use the ball on my face to start to like roll out and wake up my face. And then funny enough, I'll even do the ball on kind of like my hands and my neck because there is something special about kind of like the nature of the texture that it almost like sticks and grabs your skin and kind of
Mhm.
like manipulates it in a very sensory powerful way. And it's just I've actually found in myself a great way for me to kind of connect my mind to my body and wake myself up is doing this practice in the morning. So
Mhm.
like and I stack it with my morning caffeine, and so it's just like this a great way to wake up. I think I just need to start brushing my teeth and do it and start it 10 minutes earlier.
I love it. I love it. But yeah, a lot of people will actually say that it is kind of like their morning espresso is that they're getting, the textural stimulation, which is very brain activating. So I love that you do that. And I personally use one of our products that isn't out yet. It's most of our insoles are all of our insoles right now are flat. We have a arch support one that's coming out in September, and I've been using that as a way to kind of test out an activation protocol that we can do with it. So I put it in my slippers and I use this very stimulating arch insole to wake up every nerve in the bottom of the foot when I walk
Mm.
around and when I get ready in the morning. So great way
I
to
love that. I can't
mentally get
wait for that to come out. So, circling back to okay, so let's say someone's never done barefoot training. How do they start to get into it? Because I was one of those overachievers who, when I first got into barefoot training, I got the Vibram Five Fingers
there.
and I just started like running, trail running, not even building my strength up, just kind of like pushing through the pain. Ended up, making my like shins really hurt, my calves really hurt, and my feet kind of did not like it. And I eventually had to back off because I was forced to back off just because my feet. I was also jump roping a lot
Mhm.
in them, and that also just created like almost like a permanent limp. Like I was, but I was so committed to my barefoot training. Fortunately, I'm a lot wiser now. So this last year, I've done it a lot slower and gotten a lot stronger. But I'm just to help. those who are new to barefoot training, how would you recommend or coach someone into like adopting that lifestyle?
Yeah. So for the listeners, when we say barefoot training, I don't want them to think that they have to go to barefoot running, because to be barefoot or to optimize foot function in a barefoot way or an integrated foot strengthening way doesn't mean that you have to run. I don't run. I'm more of a cyclist than a runner. So the whole barefoot thing, running is an option. Barefoot training could be maybe doing lifts. You do some of your Olympic lifts. Maybe you do kettlebells barefoot. Maybe you do all of your squats and your lunges. Or if you do Pilates and yoga, technically you're doing barefoot training in those practices already, right? So I just want the listeners to know it can look like several different things. And then another way that I really like to teach barefoot training is in barefoot movement prep, which means you're taking 5 to 15 minutes of a workout. And that's where you're doing a lot of your mobilization work. You're waking up your feet. Maybe you're doing short foot, foot to core, some balance exercises, and you're just priming the nervous system. So it could look like several different things to everyone based off of it. Okay. Now, for it, I like to release the feet before every session. So the neural ball release that you had shown, Justin, or that you kind of spoke about, I would actually want to do that before barefoot training, before a barefoot workout, maybe some barefoot balancing, or if you're going to go barefoot running, whichever it means to you, is I want you to release your feet on the neural ball to wake up the muscles, get the circulation going, and to stimulate the nerves. I then have people understand how to find a stable base. So on YouTube, I have videos, and when I see patients, I will teach them how to find neutral. I just want them to understand the articulation of the feet, and then I want them to feel what a foot contraction feels like. So I teach that through a technique called forward lean, where a forward lean would be that you would stand with your feet shoulder width apart. You would find your foot tripod. So you're underneath the first met head, or if the first toe, the fifth toe, and the heel. So think of that. Lift your toes, spread them out wide. So you're starting to set your base, feet shoulder width apart. You're standing nice and tall with your arms by your side, looking straight ahead. And then you're just going to start to lean your body forward. So it's a subtle lean of the body forward. And then you go back into a vertical position. And then you just subtly lean forward, back into a vertical position. And you'll do that 5 to 8 times. What you should notice if you do this is that every time you lean your body forward, your toes anchor and push down into the ground. So you are activating a postural reflex when you do that. But that postural reflex is engaging your foot stabilizers. So I need people to know what that feels like.
Mm.
And then you would build that into just a little bit of foot strengthening exercises, short foot, maybe a single leg balance. So you're doing something. That is where I want people to start their barefoot training practice, is wake up the feet, wake up the nerves, wake up the muscles, understand what that feels like, understand a stable base. If that's where they need to just start, and then they put their shoes on and they work out as normal, then that's where we start. Eventually, you can start to then introduce other exercises. If they're non-impact based, like a squat, a lunge, bicep curl barefoot, a kettlebell swing, then it's very easy to transition to that type of barefoot training because there's no impact. You just have to be understanding of your foot tripod and a stable base as you go through it. Now, for anything that is more impact based, you were doing jump rope, let's say, or someone wants to do step ups, box jumps, something a little bit more dynamic, then you have to have a baseline foot strength so that you do not get hurt from the impact. Okay. And that's where a lot of the bad press kind of came out with Vibram and the five fingers in 2008 through 10, when they were seeing a lot of injuries from the shoes, where it really wasn't the shoe. It was that there was no transition understanding of running in supportive shoes to running in five fingers. And people were just getting hurt because there was no baseline foot strength. So if you are going to fully run, you have to have this baseline foot strength through forward lean, short foot, single leg balance, maybe do some squats and lifts and step ups before you start running. And then as you transition into barefoot running, if that's your goal, then you slowly increase it. And maybe barefoot running or minimal shoe running, which is really what most people would be doing, is something you save for shorter runs. And maybe you never have to run a marathon barefoot because that takes a lot of patience and very progressive programming to do that without an injury. So that's kind of where you want to start. Last thing I want to say on that is as you increase your barefoot training, as you increase the stress to your feet, jumping rope barefoot, box jumps barefoot, maybe barefoot running, you have to recover. And that recovery would be release your feet, get the narrow ball out again. Maybe you go into a little bit more cushioned shoe, maybe like an ultra or something like that when you are not working out, just to give the feet a little time out so they can heal themselves. And you just kind of find that balance between stress and recovery in an intelligent way that is progressive, and you listen to your body the entire way.
Yeah. I learned that the hard way. So I went through one kind of series of barefoot, training where I just like pushed through all the pain and really caused my body a lot of injury and stress. And then the second time around, I've been a lot more in touch with what my body needs. So I built myself up. So I, started with working out in like the Vivo bare feet
Mhm,
shoes. And then whenever I kind of over like got to the point where they're sore, I put my Nikes back on that have
mhm,
way more cushion. And then I just like take a day or two off and then I go back to them. And then I got some sandals,
mhm,
XERO sandals,
mhm,
and I started wearing those to the gym. And I just do all my strength training, all my bodybuilding in those. And then I moved to Santa Cruz where they don't care if I take my shoes off in the gym. And I literally just wear the toe spacers display. I wear my zero sandals in, and when I go to the bathroom, but when I'm working out in my gyms in Santa Cruz, I just have the display on, and I'm completely barefoot. And I can do. I've now trained myself up slowly, but I can do like 30 to 60 minutes on a stairmaster or a treadmill, like either barefoot or with the zero sandals on, and my feet are totally fine. um but if I go like running, because I'm not much of a runner, but like occasionally I'll do some like trail running, which I really enjoy, and if I'm wearing my zero sandals, I'll just run in those. But then that means the next day maybe I'm wearing my Nikes again because I need that recovery
mhm.
time.
Yep.
Or I like if I think I'm gonna go trail running, I just like bring my Nikes and I might like barefoot run for a bit and then put them back on and be like, okay, that was awesome. Now let's like make sure I don't overdo it. So with age sometimes comes wisdom. And I think I got a little wiser about it. But just to give some of what Dr. Emily was saying, like into perspective of how I've been incorporating it. So I pretty much all my strength training, whether I'm training on gymnastics rings, traditional bodybuilding with barbells and dumbbells or kettlebells, is all completely barefoot with the toe splay in. Which is another one of your products, which helps like your feet like splay back out. I
Mhm.
don't have it handy right now, but the kind of there we go. Yeah, perfect.
Yeah.
Question about that. So my pinky toe is like just jammed into the side of my foot. Like and like I can put the toe splay on and it's fine, but as soon as I take it back off, it goes back in. Does that ever go away?
Most likely not. That's the curse of what's called a varus toe. So it's a varus rotation. It's kind of rotated and contracted and like hanging next to its neighbor. Um, I guess interesting fact is that the way that the toes are aligned and the muscles pull, there's no muscle on the outside of the fifth toe that can support it in a rotated and spread direction. So it's just a kind of
Gotcha.
evolutionary design of the foot that the fifth toe kind of drifts in.
Yeah. I mean, I'm getting good spacing in between all my other toes, and I'm like, aiming for perfection. I want that, like, I want my toes to look like my hands, but apparently, I'll have four of them in alignment, and one of them can be the rebel. Um, the last kind of thing that I really want to touch on is something that may or may not be applicable to me, but definitely applicable to the audience. And it was something I heard about in one of your podcast interviews. I believe it is on Mark Bell's show, where you talked about sports hernia, or I think what you said called it athletic pubalgia or something like that.
Yep.
So
Yep.
I thought I got like a groin tear, like I thought I tore my groin, and I did research, and it's like they just take a long time to heal, and it's been about a full year now. And so I can jog, but I can't sprint. And like, cuz it just will aggravate the hell out of it. So if I do like a really long stride, or if I try to do too much kind of like I've occasionally tried to do like weighted leg raises, which
Mhm.
immediately re-aggravates it and causes, like, literally to the point where like I'm not even doing anything and it hurts really bad. And it's like in my like pelvic area. Is
Mhm.
that sports hernia, or like help me understand what's going on? Cuz
Yeah.
I heard you had something similar to this.
Yes, this is another topic that I'm very passionate about because I had this injury and I was very just kind of pushed away or poo pooed from the Western medical um, institution about it because of they're essentially profiling me and that type of injury and saying you don't have it. So, just for the listeners, athletic pubalgia or a sports hernia is it's not a true hernia, so it's kind of like a pseudo hernia, and it's an injury in the groin, and in the groin you have your rectus abdominis, so right, think like the six-pack muscle that goes all the way down to your pubic symphysis, so it's attaching onto your pubic bone. And then as your rectus abdominis comes down, your adductor longus, your adductors, are essentially coming together, so you have this tendon fascial connection between your abs and your adductors. Okay. And then part of how you maintain stability around your pelvis or your groin, if you want to call it, that's actually your anterior pubic joint, is your groin, is balance between a tug of war between your adductors and your rectus abdominis. So what's pulling your pelvis forward into an anterior tilt are your adductors is part of it. They're pulling down. And then what's trying to keep your pelvis neutral or in more of a posterior is your rectus abdominis. So you could see this tug of war. Okay. If you have deeper pelvis instability from the pelvic floor, the TVA, the psoas, whatever it is, just neuromuscularly stabilizing it, your adductor can essentially win that tug of war. And when it pulls hard enough, it can tear your rectus abdominis fascia. So
Mm,
imagine like a saran wrap sheath that tears and then it retracts up a little bit. And the tear, that athletic pubalgia, the sports hernia, is that rectus abdominal aponeurosis, the fascia tears. And this is what I had, and it presents as either a adductor spasm, pain on the pubic bone. So if any of the listeners suspect they have this, you just palpate your pubic bone and you'll have pain there. Or it can go a little bit higher, which is into your rectus abdominis. And it'll be triggered on things that are requiring hip flexion. So it could be running, walking, climbing stairs, doing different abdominal exercises where either your upper body is fixed, so you're in like a preacher chair and you're bringing your knees up, hanging on a bar, you're bringing your legs up. So you're fixing one point and then doing the other. Someone's sitting on your feet and you're doing old school sit ups, like that kind of technique. And it will definitely have to be MRI'd to show it. And then the MRI will typically demonstrate this tear in the rectus abdominis aponeurosis. Now, oftentimes it will be misdiagnosed or confused as a hip labrum tear. And the reason is that hip labrum tears typically present as groin pain because your hip is right in the center of your groin. So they'll say if you have groin pain, first thing that a orthopedic surgeon's going to think is hip labrum. So they'll treat it as a hip labrum tear. They'll order an MRI most likely of your hip, but a hip MRI isn't necessarily going to show the anatomy of the pelvis. You have to get a pelvic MRI, not a hip MRI, so that they can visualize it correctly. If you do tear fascia or this aponeurosis or a tendon, this is what I know from my practice in doing regenerative injections, is just rest and immobilization will not heal a tear. You have to do either surgery or stem cells. And because of the unique tension that is placed on the rectus abdominis fascia, this connection with your adductor longus, is you really need surgery for it. So I had surgery on my rectus abdominis and this sports hernia that I had in 2012. I went to Dr. Myers, who is actually the world specialist on sports hernia. And he's done most of the research and most of the publications around sports hernia and brought it to the forefront that people have to pay attention to this injury. He's out of Philadelphia, and Dr. William Myers. And I went and saw him. He did the MRI and he said, sure enough, you have a right sided sports hernia. I did surgery 2 days later. And like that, my pain went away. I literally woke up and I was like, that's exactly what it was. After being pushed around saying, no, it's your labrum, do physical therapy. You have to do an injection to your hip. Just strengthen your core. I think you have pubic symphysis syndrome. And I was like, no, it's different. It's something. It's triggered when I bring my legs up in on a bar. When I run, I can't do this. So I had to take it upon myself to go to Dr. Myers and say, I think I have this. Right. And he listened. He's an incredible human being. So he's great. And his technique is very different than other surgeons who mesh it. You don't want to mesh a sports hernia because it's not a true hernia. He
Mm.
actually does a approximation and resutures it to the pubic bone. So his technique is different than a lot of other surgeons.
How long was your recovery before you could like run and like, do like leg raises and do the things that would normally aggravate it?
Well, yeah, so that isn't that's another story. There's a story and everything. But that was another story that I had it and my symptoms went down. My primary symptom was also my great saphenous vein was indurated, and which means it was like blown up. So the whole vein down my leg. And I couldn't sit, I couldn't stand. Every position would cause severe pain down my entire leg because of that vein. So that's the part that immediately after surgery, that vein and that symptom
Mm.
totally resolved. Now, aside from that, the adductor spasm, so the neuromuscular imbalance that I had in my pelvis, meaning inhibited pelvic floor, inhibited psoas, active adductor, that wasn't fixed from surgery. Just the tear in the fascia was. So it took me, not to make it intimidating, but it took me a year to rebuild the neuromuscular control. Now, why
Mm.
I say that as a story is because that's how I learned about the pelvic floor so much and how I now,
Mm.
for my patients, look at the pelvic floor function and the balance of foot to core stabilization because I had the sports hernia. So I use that as an opportunity to actually expand my knowledge in human movement and how it could help my patients. So I had to do a lot of pelvic floor work and balancing out the timing of the stabilization around my pelvis to be able to then get back to my strength. But something inspiring for you, Justin, is once I did do that, my strength and my core was stronger than I was a gymnast growing up. Then when I was a gymnast, and I do aerials now, and I was the strongest that I've ever been in my life after that surgery.
You're
So there's that.
you're giving me hope because I've been trying for about a year to just like take it easy on it, like not do any sprints. I honestly, I think I may have tore it because I do a lot of rollerblading, and I
Mhm.
would rollerblade around to these fitness parks, and I would do hanging leg raises with my rollerblades on. And I think I just like went too hard, and like kind of the using that muscle to rollerblade, and then doing weighted leg raises with my rollerblades on that, or I hurt injured it like doing sprints or on the Peloton.
Yeah.
So it's just I've been trying to, but I think now I need to maybe go see Dr. Myers
Yeah.
and get it taken care of, because like I miss sprinting. Like I'm not like a big runner, but I love like to do a sprint on grass barefoot. Like that is like just such a fun thing. And when I do aggravate it, it just like it life is not good. So
Mhm.
I think
Well,
you go ahead.
to give you a perspective or how I injured, just it was funny how you had said that, is I was cycling. I was doing indoor cycling, like very fast, doing sprints on it. And then I went to the bar and I was bringing my legs up and doing L raises on the bar. And I'm holding, holding, holding. And my rectus abdominis, my abs fatigued because of the cycling before. And then my adductors kicked in and it went like that. So it was
Um,
doing an activity and then training my abs on already fatigued abdominals, and then it
yeah.
ruptured. So possibly that sounds like what you might have.
Yeah, I was doing like the Peloton like crazy often, very hard, like going as hard as I could, like climbing hills, like basically not like for 30 plus minutes, then like rollerblading and doing weighted leg raises or like L hangs. And it sounds like I did something very similar. So, if this is resonating with you, you think you have pulled a groin, or because I also thought I had like regular hernia, but I couldn't find any like bump or anything. So I this has been deeply insightful. So um, the last kind of thing. Do you have a few more minutes before we shut this down? I just want to
Mhm.
ask you one, a couple more things. Okay. Um,
Absolutely.
this is a bit of a left turn, and we can cut it out if it doesn't work. But one of the things that I always like to ask audience, or ask for the audience and for myself from the guest, is one tip, tool, or strategy that you would recommend for fitness, one for money, and one for life. And this could be anything that comes to mind, but just like if someone came to you and said, "Hey, like give me a tip, tool, or strategy to level up my fitness, to level up my money, and to level up my life," like what would you share with them?
Okay. What I would say for the tip for fitness would be that your breath is the driver to stability. So don't ever underestimate the power of breathing, especially in any technique that you're doing or as a way to recalibrate your autonomic nervous system and get you set up for the stress that you are about to do under exercise or fitness. For money is uh, okay. For money, I would say never put your head in the mud. And you have to look at your finances head on. I've learned that through Naboso that as soon as I finally like really looked at the vulnerability of the books is when I actually started to see accelerated growth, and it wasn't as scary. It was more like this is just numbers. It's not scary, it's numbers. Granted, there's money behind it, so there's always that risk, but you can look at it very quantitatively, very versus emotionally. And that's really unleashed Naboso as far as growth and our growth trajectory. And then for life, I would say listen to your gut. Your gut
Mm,
always knows. So listen to the gut, follow your intuition, and then break the jump.
yes, so good. Any last words or requests to the audience, or anything else that you would like to cover? Maybe a mention of the book that you're working on.
Well, my first book, which is out, is a very quick read. It's called Barefoot Strong. And the goal of that book is to pique people's curiosity and to just build an appreciation of the foot. That's my first goal is appreciate the complexity and the power of the human foot and how integrated it is into every aspect. And then, yes, I have another book, but it's going to take a minute for that to be out. So that is a balance training focused book, a neuromuscular approach to balance training.
Awesome. Well, Dr. Emily, where's the best place for people to connect with you online?
I would say social media. So Instagram, my handle is the functional foot doc. My practice website is my name, so dremilysplichal.com. I see patients virtually, also in Arizona, but most of my patients are virtual, and I can treat almost anything virtually. Obviously, can't do injections, but just in case people are curious to have a consultation. And then to learn about Naboso is naboso.com, and Naboso is on social media as well.
Awesome. Thanks for coming on the show, Emily.
Thank you so much.